Hello everyone, and welcome to KS Medical Coding Academy. Welcome to Lesson 11, E.M. Preventive Services. In this lesson, we'll learn how to code preventive medicine visits using CPT guidelines. We'll cover preventive service codes, age-based code selection, new and established patient visits, documentation requirements, Medicare preventive services, counseling, Modifier 25, and coding examples. By the end of this lesson, you'll understand how to accurately assign preventive E.M. codes for both the CPC exam and real-world medical coding practice. Let's begin. Before we begin, please note that this training is for educational purposes only. Medical coding guidelines are updated regularly. Always verify your coding decisions using the latest CPT, ICD-10CM, HCPCS Level II manuals, official coding guidelines, and payer-specific policies before assigning codes. In this lesson, we will understand the key concepts of preventive service coding and the guidelines used for accurate CPT code selection. First, we will define what preventive services are and understand their purpose in promoting health and preventing disease. Next, we will review the preventive service coding guidelines, including diagnosis coding requirements and how to select the appropriate level of preventive service based on patient age and encounter type. We will also learn about counseling and risk factor reduction services, behavioral change interventions, and the rules for reporting multiple E.M. services performed on the same day. Finally, we will reinforce these concepts with practical coding scenarios through a knowledge check. By the end of this lesson, you will have a clear understanding of preventive E.M. services and be better prepared to accurately assign CPT codes in real-world medical coding practice. Let's begin. Let's begin by understanding what preventive services are. Preventive services are evaluation and management, or E.M., services provided to patients who come for routine health maintenance rather than for the treatment of an illness or injury. These visits are commonly known as preventive health examinations or annual wellness visits. The primary goal of preventive services is to assess the patient's overall health, identify potential risk factors, and detect diseases at an early stage before symptoms appear. During a preventive visit, the healthcare provider reviews the patient's medical and family history, performs an age-appropriate examination, evaluates lifestyle and health risks, recommends screening tests and immunizations, and provides counseling on healthy habits such as proper nutrition, regular exercise, and disease prevention. Unlike problem-oriented E.M. visits, preventive services focus on maintaining good health, preventing future illness, and promoting long-term wellness. Proper documentation and accurate CPT code selection are essential to ensure correct reimbursement and compliance with coding guidelines. In this slide, we'll look at the key elements required to correctly code preventive services. There are three main factors that determine the appropriate CPT code. The first factor is the type of examination. This includes Medicare Initial Preventive Physical Examination, or IPPE, the Medicare Annual Wellness Visit, and comprehensive preventive medicine services for both new and established patients. The second factor is the patient's age. Preventive medicine codes are age-specific, beginning with infants younger than 1 year and extending through patients aged 65 years and older. Selecting the correct age category is essential for accurate code selection. The third factor is additional services performed during the preventive visit. If the provider evaluates a separate medical problem, a problem-oriented E.M. service may also be reported with Modifier 25 when documentation supports it. Other additional services may include behavior change interventions, such as smoking cessation counseling or alcohol and substance abuse screening, as well as vaccinations, diagnostic tests, and other medically necessary procedures. Remember, preventive service coding is based on the combination of the examination type, the patient's age, and any separately documented additional services. Always review the medical documentation and payer-specific guidelines before assigning the final CPT codes. In this slide, we'll discuss how to report a preventive visit when a patient also has a sick visit on the same day, and when Modifier 25 should be used. A preventive medicine visit focuses on routine health maintenance, screening, counseling, and disease prevention. However, during the same encounter, a patient may also present with a new complaint or an existing medical condition that requires additional evaluation. Modifier 25 is reported only when the physician performs a significant, separately identifiable evaluation and management service beyond the preventive examination. The documentation must clearly support the additional work performed. Let's look at the examples shown in this table. For shortness of breath, Modifier 25 is not appropriate when symptoms occur only with exercise in an otherwise healthy, deconditioned patient. However, it is appropriate when a patient with congestive heart failure develops worsening shortness of breath and requires further evaluation and management. For chest pain, Modifier 25 is not reported when the pain is due to a minor injury that is already improving. It is reported when chest symptoms are associated with a new illness, such as cough and fever, requiring a separate medical evaluation. For vaginal bleeding, a long-standing menstrual pattern without change does not support Modifier 25. But new heavy bleeding with dysmenorrhea in a patient with a significant medical history requires additional assessment and supports reporting a separate E/M service. For a skin lesion, a benign lesion that only requires reassurance is considered part of the preventive visit. In contrast, a suspicious or dysplastic lesion requiring excision and pathology represents significant additional work and may qualify for Modifier 25. For knee pain, stable chronic osteoarthritis without any change does not justify a separate E/M service. However, worsening osteoarthritis requiring additional evaluation and a knee injection supports Modifier 25. Finally, for contraception, simply starting oral contraceptive medication during a preventive visit generally does not qualify for a separate E/M service. If the physician performs a significant procedure, such as inserting an intrauterine device, separate reporting may be appropriate when supported by documentation. The key point is that Modifier 25 should never be used routinely. It is reported only when the physician performs a significant, separately identifiable evaluation and management service in addition to the preventive medicine service. Always review the provider's documentation carefully and follow captain and payer-specific guidelines before assigning Modifier 25. Now let's understand the preventive service code sets used in medical coding. Preventive services are divided into two major categories: Medicare Preventive Services and Comprehensive Preventive Medicine Services. For Medicare, three common HCPCS codes are used: G0402 for the initial preventive physical examination, also called the Welcome to Medicare visit; G0438 for the initial annual wellness visit; G0439 for subsequent annual wellness visits. For non-Medicare patients, preventive medicine services are reported using captain codes. New patient preventive visits use captain codes 99381 through 99387. The correct code is selected based on the patient's age, from infants younger than 1 year through adults 65 years and older. Established patient preventive visits use captain codes 99391 through 99397, which are also selected according to the patient's age. When selecting a preventive service code, always consider three important factors: the patient's insurance type, whether the patient is new or established; the patient's age on the date of service. Accurate code selection, supported by complete documentation, helps ensure proper claim submission, reimbursement, and compliance with coding guidelines. Let's now discuss counseling and risk factor reduction services. These are preventive services provided through face-to-face counseling by a physician or other qualified healthcare professional. The primary goal is to promote health, prevent illness, and reduce the patient's risk of future medical problems. The counseling provided depends on the patient's age, lifestyle, medical history, and individual risk factors. Several important topics may be discussed during these counseling sessions. First, family problems, where the provider addresses family relationships, emotional support, stress management, and other issues that may affect overall health. Second, diet and exercise. Patients receive guidance on healthy eating habits, maintaining an ideal body weight, and participating in regular physical activity. Third, sexual practices, including education on safe sexual behavior, prevention of sexually transmitted infections, and reproductive health. Another important topic is injury prevention, which includes advice on home safety, workplace safety, fall prevention, and accident prevention. Providers may also discuss dental health, emphasizing proper oral hygiene, routine dental examinations, and prevention of dental diseases. Finally, physicians review diagnostic and laboratory test results, helping patients understand their findings, answer questions, and recommend appropriate follow-up care. Remember, preventive counseling is designed to educate patients before disease develops. Proper documentation should clearly record the counseling topics discussed, patient participation, and any recommendations provided. Accurate documentation supports correct coding, medical necessity, and successful reimbursement. Let's review the important coding guidelines for counseling and risk factor reduction services. When counseling is provided on the same day as another evaluation and management, or E.M., service, the E.M. service may be reported with Modifier 25. However, Modifier 25 should only be used when the E.M. service is significant, separately identifiable, and fully supported by the provider's documentation. Another key rule is that counseling codes 99401 through 99404 for individual counseling and 99411 through 99412 for group counseling should not be reported together with preventive medicine service codes 99381 through 99397 when both services are performed during the same patient encounter. In these situations, the counseling is considered part of the preventive visit. If counseling is provided during a separate encounter on a different date, the appropriate counseling code may be reported separately. Always ensure the medical record clearly documents the counseling provided, the topics discussed, the time when applicable, and the reason for the service. Proper documentation supports accurate coding, correct reimbursement, and compliance with CPT guidelines. Remember, when in doubt, review the latest CPT coding guidelines and payer-specific policies before reporting these services. Let's discuss behavior change interventions. Behavior change interventions are structured, evidence-based services that help patients adopt healthier habits, improve overall health, and reduce future health risks. The first step is to assess the patient's readiness to change and identify any barriers that may affect progress. Understanding the patient's motivation helps the provider develop an effective care plan. Next, the provider advises the patient about healthy behavior changes and explains the benefits of adopting those changes. Practical recommendations are then provided through an individualized action plan that is realistic and achievable. Motivational counseling is used to encourage patients, build confidence, and support long-term commitment to healthier behaviors. Follow-up appointments, referrals, and additional support services are arranged to help patients maintain their progress. From a coding perspective, health and behavior assessment and intervention services, including CPT codes 96156, 96158, 96159, 96164, 96165, 96167, 96168, 96170, and 96171, should not be reported on the same day as counseling codes 99401 through 99412. If a significant and separately identifiable evaluation and management service is also performed on the same day, the E.M. service may be reported with Modifier 25, provided the documentation clearly supports both services. Finally, complete documentation is essential. The medical record should include the intervention performed, patient response, time when applicable, and the follow-up plan. Accurate documentation ensures compliant coding, proper reimbursement, and high-quality patient care. Let's review this knowledge check. In this scenario, a 55-year-old female patient is visiting a new internist for the first time. Although she has a history of gouty arthropathy, today's visit is primarily for her annual preventive examination rather than the treatment of an acute medical problem. During the visit, the physician performs a comprehensive history and physical examination, provides counseling on diet and exercise, and orders appropriate blood tests as part of preventive care. Because this is the patient's first visit with the provider, she is considered a new patient. She is 55 years old, which places her in the 40 to 64 years preventive medicine age category. For a non-Medicare preventive medicine visit in this age group, the correct CPT code is 99386. The key point to remember is that preventive medicine codes are selected based on patient status, whether new or established, and the patient's age, not on the presence of stable chronic conditions. Stable conditions may be addressed during the preventive visit as long as they do not require a separate problem-oriented E.M. service. Therefore, the correct answer for this case is CPT code 99386. Let's work through this knowledge check. In this case, a 16-year-old established patient comes to the physician's office for her annual preventive examination. During the visit, she also reports a 4-day history of abdominal pain with occasional vomiting. The physician completes the preventive examination, performs a medically appropriate history and physical examination, obtains vaginal and cervical cultures, orders stool cultures, and documents moderate medical decision-making to evaluate the patient's new symptoms. Since this is an established patient between 12 and 17 years of age, the preventive medicine service is reported with CPT code 99394. However, the physician also evaluated and managed a separate medical problem during the same encounter. Because this problem required additional evaluation and moderate complexity medical decision-making, a separate office EM service can also be reported. The appropriate office visit code is 99214. Since it is reported on the same day as the preventive service, Modifier 25 must be appended, making the code 9921425. Remember, Modifier 25 is used only when the physician performs a significant and separately identifiable evaluation and management service in addition to the preventive visit. The preventive service covers routine health maintenance, while the abdominal pain and vomiting required additional assessment and management. Therefore, both services are separately reportable. So, the correct coding for this case is 99394 for the preventive medicine service and 99214 with Modifier 25 for the separately identifiable problem-oriented EM service. Always review the documentation carefully to ensure that the additional EM service is medically necessary, fully documented, and supported before reporting Modifier 25. Thank you for joining us for Lesson 11, EM Preventive Services. I hope this lesson has helped you understand the key concepts of preventive service coding. Keep learning, keep practicing, and always refer to the latest coding guidelines. Thank you for learning with KS Medical Coding Academy. See you in the next lesson.